Tim here again with Dr. Mary Devereaux. Today, you brought up a really interesting thing that you are just starting to offer. You're calling it concierge medicine,
Yes.
and that's really it's very important because you should always have a second opinion when you do any kind of medical before they send you in to get surgery or put you on some kind of potentially addictive medications or anything that's a serious medical condition. You should really have a second opinion first. So do you prefer to be the first opinion or the second opinion?
Well, I prefer to be the first opinion. When you have something that's going on, just talk to me about it and let's look at some options. But once you go to a physician and they tell you something, come to me and let's look at options, because a lot of times you might go to a doctor and they're like, okay, your gallbladder's inflamed, let's take it out. Okay, let's talk about that first. Have somebody to talk to about that, other options.
Tell me about how this works. Like, how would a patient start to be under your care? How does the whole thing work? Explain the concierge medicine thing. I think it's fairly a new thing, isn't it?
Right. Ever since COVID and people just being tired of being sick and not be able to go to their physicians, they want to be able to just contact someone. And a concierge physician that you can contact 24 hours a day, 7 days a week. I mean, I do sleep, but if you send to my private cell, you send a text message, or you can send an email. I have a private server where you can send your lab works in and you fill out, full scope of what's going on with you. Then I review it. Then I set up a FaceTime with you and talk with you and really get to know you, because it's real easy to throw out something to someone, but if you don't know more of their backstory, what's happened, what traumas, what accidents they've had, what's causing the headache. Maybe they were in a trauma 20 years ago and that's not resolved and they're still getting these headaches. So let's resolve that, that pain in their back that they're having that could be causing these headaches. It's the more I can know about them, I can help them in the right direction. And so I value that. And I want that intimacy with individuals, not just a bunch of people just coming in, I see once or twice and, try to help them with what I can.
So this would be a form of telemedicine where you would act as maybe a consultant or a patient advocate. You would sometimes, I guess if they're in the area, meet with them, but most of it's done over the internet or over the telephone?
Most of the time it'd be Zoom or FaceTime from on the phone, or they can just call me and ask questions. So, I mean, if they have like an injury, so like let's say they have tennis elbow, I can FaceTime with them and show them how to maybe tape it, how to work stabilizers in the arm so that goes away quickly. Because as we know, if we've ever had tennis elbow, it can last a long time because a lot of things we do all aggravate that tendon right there. So then I would need to see them face to face, but it might be something simple. They just want to reach out to somebody and I can help them in the right direction.
So you're involved with, as we've talked before, with Eastern medicine. And are these some of the maybe solutions that you will offer people before they go under the knife or try some of these alternative things?
Absolutely. And I'm board certified herbalist. And what that means is I know the qualities, the temperature, the nutrients, like the science of all like fruits and vegetables and foods. So I can tell you what's going to cause inflammation in your body and what's going to take away that inflammation, and how to, if you have like a cold, how to eat the right food if you have a runny nose or you have a sore throat, like things like that, which are very basic and kind of easy for me because I really like doing that. But then acupuncture, I can help you go to the right person for acupuncture and what your needs are, because acupuncture is so amazing. It sends a small little signal to the area, like a little micro trauma, gets blood flow, gets oxygen. It helps you relax and let down. You're literally pinned down, so but you don't feel it. And it's really thin and it kind of feels pretty amazing, actually. You'd think you'd be freaked out. It was my last resort when I did it, but I'm so happy and thankful I found it.
So what type of conditions would you be able to assist people with using your concierge service?
My main patients that I like to talk to are going through hormone deficiencies, like, from thyroid to estrogen, and they have like perimenopause, menopause, and it comes and goes, and it's hard to understand it. And they don't want to be on a hormone medication the rest of their life. They don't want to be on an estrogen. They don't want to have testosterone pellets. And it's doable, and there's reasons why that we have our hormones out of whack, and there's ways that I can help them with that.
You, as a concierge, would probably recommend somebody would try the Eastern ways first, the more natural ways first, before they do something, or before the last resort, I guess, is the Western medicine approach.
Yeah, I like to think that Western medicine also can offer because natural, it's kind of deemed as not strong, but natural is science. You lived off the land, and that's very powerful medicine. So to say natural as like a shortcoming, it's just really strong first. So I want to offer them the right, vitamins that they need based on the foods that they need, and so then have those tools to go to the doctor, a Western doctor, and say, hey, I'm trying this, I'm doing this, and have them work with you. Because if they don't want to work with you, then they don't value your body. And you have to value it's your only body you have, So having all the tools that you can go to them with is important.
I think it's a great approach. Now, I watched your video before we had this meeting, and you mentioned that when you meet a patient for the first time, you ask them, what do you ask them? How are you?
Oh, yeah, I do. I know. That's
And what do you get when you ask somebody, how are you? What do
Right.
they usually say what?
I'm fine. That's what we do in our society. How are you today? I'm good. And then you sit there and talk for like 5 minutes, then their cat just got run over by a car, they have an ingrown toenail. I mean, they're just got things going on. So that's our society, that apologetic, like, I'm fine, don't worry. And then I start talking to them for a little while, and I'm like, they have acid reflux. And I'm like, well, that's not fine. That's not good. And there's reasons why you have it, and we can take care of that. So
That's cool. So you can do this online, over the telephone, with a lot of things.
Right. I'd like to see people face to face, but after a while, they might be tired of looking at me, and maybe they just want to send me a quick text. And just like follow-ups are easy enough as a text, or and I'll follow up with them on how they're doing, because it's easy to get back into old habits. And it's not. I mean, there's reasons why you crave salt. There's reasons why you crave sugar, and like the brain is mostly run by sugar. We should have sugar, not stay away from sugar, but here have this process.
You're telling people, wait a minute. So sugar is not the evil killer that everybody's talking about.
No, white.
How about salt?
Yeah, salt. Salt is like the most important nutrient that you need.
Oh, yeah.
Like, it's like
you just
a
turned the
multivitamin.
entire nutrition community upside down on its head. So these are things that people can talk to you about, depending on what their symptoms are, what their ailments are.
Right. Yeah.
And food can be a solution.
Food is the solution. Yeah. And breathing.
Well, it sounds like that your methods are really the place people should start. I mean, maybe people should see you as a primary, and then get a second opinion from somebody in Western medicine, maybe?
Yeah, I agree that you should start with knowing what your body needs naturally first, and then go from there.
So what about problems that a lot of us are afraid to talk about, like weight loss and the word that you hate, diet?
Oh, I hate that word diet, because, you search and you have to go with a diet that you might like the food, you might not like the food. And eating a cold salad every day is not going to make your stomach that's 110 degrees and acidic feel good to do that every day, to get those nutrients in. And you might not be able to absorb those nutrients that way. So it's really important to, when you want to lose weight, have a personalized care that just meets your deficiencies, what your body is needing to lose that weight. It could be a hormone thing, and it could be that you're doing too many cold foods and your body's upset, and so you're working on that digestion. And it could be the bacteria growth that you need, the gut biome that's so trendy, but it's important. But how do we find those good fermented foods? Like, people aren't going to eat certain things that are fermented. They go, I hate kimchi. Okay, well, let's find something you do like. It's really important, because you will die without the bacteria in your body.
So I've decided I want to do this.
Great.
I want to talk to you. I want to hire you. I want to enter your concierge service. So what do I do? How would I do this?
Okay, well, first you sign up, and then I send you all the paperwork. That's all HIPAA protected, so that means that no one sees it's on a secure server. And I go through all your information, everything that you want to talk about. And normally I'll get probably like 40% of what people want to talk about, and then I can pull more out as we go. And then, so I send you the information, you fill out the information, I receive it, and then we set up a time to meet that week. As soon as, if you're really in urgency, you call me, we'll take care of things. If you have to go to a doctor's appointment, you're going to have an upcoming surgery, and you just really want to talk about that, anytime. But usually it takes about a week for somebody to kind of get, into talking with me, and because they just aren't ready.
You build a relationship.
And you have to be ready. You have to be like, I'm ready to do this.
Yeah.
And even if you're not as excited to get started, you still just want to have me on hand. And when cold season comes, that's fine too. But there might be things that, I'm ready for this. And we start right away. So you can, we FaceTime, or we can Zoom in, and we communicate and talk that way. And then we get started.
So patients sign up for this service and they're on kind of a retainer?
That's right. That's right. And so they have my personal cell phone number. They can send me text. They can please not any pictures that are. I have a 14-year-old, so.
Can they text you or call you as many times as they need to? Or is there a limit to what they can do?
Absolutely. I think that sometimes we have fires to put out. So there might be a time when you really need me. And then there's times that I might not hear from you and I'll just kind of check in, how are you doing, and send you some information based on stuff and keep you with your goals, even if you're not sure what they are. But like I said, there's sometimes when you're like, I need to talk to you. I need to talk again. I need to talk again. Can I just call you and talk with you? Because it's stressful sometimes, our health and things.
Like to me, I think that's so powerful to have a physician, a licensed physician that you could text or call or talk to about a second opinion or something else is going on or something that you're afraid to talk to somebody else about. But It's not expensive. I mean, we're not talking millions of dollars.
Oh my gosh, no. It's like a dinner a month.
So it's not out of reach for the average person.
Right. And in the long run, you save money because your co-pays for x-rays and blood work and kind of the rigmarole. How many times do you spend hours in a doctor's office to find out, oh, nothing's wrong? Yeah. Or you go to the urgent care and spend how much money, and then they say, just go home and take some, an ibuprofen or something to help you. So in the long run, you save money.
I think it's a wonderful idea. I think it's a great opportunity for people to have somebody to talk to, somebody to ask those questions other than your primary. Mm-hmm. And I feel like you are the patient advocate. You're the person looking out for these people.
Absolutely.
They're going to send them in the right direction. But you're going to, if somebody needs surgery, if somebody needs to go on medication, or you're going to tell them they need to do that?
Right, absolutely. But yes, absolutely. And if it's muscle pain or different things like that, there's just other ways to look at it before you go through a surgery. And like I have many patients that have so much metal in their back that was unnecessary because they had back pain. So why not look at other things and natural ways to move the blood there or release the muscles that are pulling, so let's look at those before you go under getting something removed or something that's permanent, with you.
Can you communicate with a patient's other physicians, their Western physicians?
I can reach out to them.
Okay.
So I'm not sure how much I can look at their medical records through them, but I'd probably have to go through the patient themselves can send me medical records and upload them up on the private secure server.
Dr. Mary Devereaux opening this exciting new thing. You're going to start seeing these things pop up all over the place.
Yeah.
I think you're really at the forefront of this industry.
I think it's about I truly want to solve the problems. And I was saying this, I think in my video, is it's about the village being healthy, not how many sick people you see. And I just want people to feel the best they can feel.
Yeah, it's a much better approach, I think, to try to solve the problem before we medicate people and do all these other crazy things. Mm-hmm. Well, I wish you best of luck with that.
Thank you.
And I will be signing up for to be one of your patients.
Great.
Is that okay?
Wonderful.
Yeah.
I feel like I'm going to have to set a limit on how many times you can text and call with your pain.
Dr. Mary Devereaux, we'll have more information in the description of this video how you can contact her directly and sign up for this wonderful service. Thanks for talking with us today.
Thank you. Thank you for having me.